It's time to go on the record with WRAL News.
Thanks so much for joining us this holiday weekend for On the Record. I'm Lena Tillett. You know, it doesn't take a pregnant woman to tell you women worry during pregnancy. Expectant moms just have so much to consider: the health of the baby, their own health, finding the right prenatal care, and trying not to drown in too much information from Google. For Black women, they also have to contend with this, frankly, frightening statistics. According to the CDC nationwide, Black women are 3 times more likely to die from pregnancy-related causes than white women. In North Carolina, that disparity is even worse, and more than 80% of these deaths are preventable. They did not need to happen. So you may now be wondering why. Some question, is it the mother's fault? Poor health and access to care issue? And turns out not really. New data shows these poor outcomes for Black women is regardless of socioeconomic status. The highest income Black women have worse outcomes than low income white women in this country. That's according to the National Bureau of Economic Research. Of course, that's a lot for Black women to carry, in addition, of course, to the baby. And while those stats feel daunting, overwhelming, hurtful, people who work in maternal health say there are known solutions. In fact, a couple weeks ago, a group of doctors, midwives, public health advocates, doulas, state lawmakers gathered to talk about this very issue in the state capitol. They called on the General Assembly to pass what's called the Momnibus Act, or Senate Bill 838. And tonight we're going to explore what's in this bill and how it can help. We have a wonderful panel here to discuss all of this and more. Dr. Saron Wheeler is an associate professor of obstetrics and gynecology at Duke University. She has done extensive research on health disparities. Dr. Charity Watkins is an assistant professor of social work at North Carolina Central University and the board chair of the nonprofit group supporting families' equity before birth. Latasha Rouse is a birth and postpartum doula. She owns Birth Sisters Doula, which is based in Raleigh. And State Senator Natalie Murdoch represents parts of Durham and Chatham counties. She also co-wrote this bill. Thank you all for joining me. It really is an honor to have you here. So, Dr. Wheeler, I'd like to begin with you. You're our resident OB this evening. You also, as I said, research health disparities. So what is causing these disparate outcomes for Black women?
That's an outstanding question, and something that many of us in the scientific field have been studying for generations. And I don't think that there's a simple answer. What we know is that this is multifactorial. What we know is that there's nothing inherently different or wrong or negligent about Black women in terms of their genetics or the way in which they're born, that this is likely due to the circumstances in which they live, that due to life courses of stress and all sorts of inequitable care and inequitable circumstances that they have experienced, that ultimately, in the setting of pregnancy, lo and behold, there are inequitable outcomes as well. Again, this is not unique to obstetrics. This is seen in many different fields of medicine. So in a lot of ways, it's not surprising at all that we see these disparities in obstetrics.
You know, Ms. Rouse, as a doula, you are in the room during childbirth. Of course, you are as well, Dr. Wheeler. You are there as an advocate, though. How have you seen Black women treated?
I've seen some that were treated very well, and I've seen some that we had to have some conversations about what was actually happening. I think when you look at the stats and people talk about how Black women aren't listened to, it happens in subtle ways sometimes. It's not one of those that is just very obvious unless you know what should be happening. So in the room, what I see is there's a question that is asked. There's a nod and a person that walks over to their computer and they start typing. And the person that is in the bed or is in labor is like, I guess it was okay, they didn't say anything. No, that is not okay. You need an answer to that question. Ma'am, did you hear the question that was just asked? Did you understand what the answer was, birthing person? Those mismatches happen so often in our daily lives when we just are in the world, how people are dismissive and can't really see us and don't understand us, that in those moments, that's when it really matters. And that's when the real world meets us in that place, in that room.
We know, though, not being listened to is a matter of life and death, potentially, in delivery. Dr. Watkins, you have a story of dealing with not being listened to. Again, you're an assistant professor, you are highly educated, but you dealt with this postpartum and you could have died. Can you share your experience?
Sure. So I had a pretty normal pregnancy other than being diagnosed with gestational diabetes. I was exercising regularly. I was watching my diet. I went to all of my prenatal appointments. I even signed up for birthing classes. So I came to birth very prepared overall with the information that was available. However, I actually heard less about what to expect after expecting. So for instance, I didn't realize that there were symptoms of heart failure that I was experiencing for weeks before I actually was diagnosed. So for instance, I was experiencing extreme fatigue. I couldn't lay flat on a pillow. I had a nagging cough that wouldn't go away. And then eventually I started having a throbbing pain in my arm that prompted me to go to the ER. Unfortunately, I wasn't able to see a doctor at that point. I waited 5.5 hours with symptoms of a heart attack in the waiting area and never got further than triage. And so it wasn't until, because I was a doctoral student at that point, that I had access to campus health, where I was told I had an enlarged heart, and then rolled right back to that same emergency room where I waited for several hours again, only to finally be admitted into the cardiac intensive care unit. And I was told that my heart was functioning around probably 5 to 10%.
Oh my gosh.
And I still see the same cardiologist now, and she often reminds me how close we were to me not being here anymore, and me not being here to care for my daughter, who's now 8 years old, not experiencing first-time parenthood with my husband, and really all of the work that I have been able to do as a result of my experience may not have happened if I didn't receive the care that I did finally after seeing several doctors, I will say, or at least trying to receive care from several providers.
How did that make you feel, though, to not be listened to? Did you start thinking you were paranoid and maybe it was all in your head because all of these medical professionals are telling you you're fine, you can go home?
Well, and that's the interesting thing, because I think that's an extra burden of racism, in that you are left worrying or wondering if it's you who is actually seeing the issue, or am I making this up in my mind? But really what I realized is that my experience was very much similar to other women who actually had even worse outcomes than I did. And so what I thought about at first was, man, I really tried my best to advocate for myself. I am not one to be very quiet. I speak up when I have questions. I have this education that I thought was going to protect me in some form or fashion, but it just didn't happen that way. And so I'm really trying to use my story now to prevent that from happening to others.
You know, thank you for sharing that. I can't imagine how frustrating that was, and also emotional, and then to find out that you had a major heart issue. I want to play this clip from a 2022 WRAL documentary. It was on Black maternal health, where 3 medical professionals were describing how they were trained to treat Black women. Take a listen.
We have Duke, Vanderbilt, UNC.
Correct.
Nurse midwives and professors Jacqueline McMillan Bowler, Stephanie Devane Johnson, and Venus Standard created a program to help stop these disparities.
When I was growing up, you know, we knew that Black women died more often in childbirth, but we always attributed it to genetics, that must be some sort of genetic thing that's making Black women more likely to die, and we'll just accept that, along with hypertension and diabetes and all the other comorbidities that are prevalent. It's not genetics. It is systemic racism that has led to this disparity across really all of those issues.
They point to problematic training happening as well.
There are also examples of things that we learned in our medical training that supports kind of racist thoughts, that people of different groups experience pain differently, that they express pain differently.
And you all were taught what about Black women when you were going through training?
That their pain level is exaggerated. They won't tell you what's real. So the in-between reading the lines is don't believe them, because they don't really need pain medicine, because their pain is not real.
Weren't you also taught that Black women have a higher pain tolerance?
Yes. Yes. And our skin is thicker and we don't feel pain the same. And absolutely.
In school.
In school.
Yeah. I didn't believe it,
Right.
but that is what we were taught. And like Jackie said, tested on. So we have to, if you want to pass the test, you have to answer the way that they want you to answer the question.
You can still find these false statements in modern healthcare textbooks. In 2017, the world's largest education company issued an apology and reprinted a nursing textbook for featuring racist stereotypes and teachings, including, quote, Blacks often reported higher pain intensity than other cultures.
I'm Tim Bozick, and I lead global product development at Pearson.
The company CEO released this video after pages were posted online.
We reinforced a number of stereotypes about ethnic and religious groups. It was wrong.
And in 2016, a study published in the Proceedings of the National Academy of Sciences found 40% of first and second year medical students falsely thought Black people's skin is thicker than white people's.
You all didn't see, but everyone here was shaking their heads, and you all clearly have experienced that or you've heard that. Dr. Wheeler, your thoughts on some of the training that people were receiving as early as or late as, I should say, 2018.
Just like all echelons of society, medicine was not spared from racism. And so it is not surprising, just like in every aspect of our culture, there are echoes of racist ideology and racist thought that are within medicine as well. We're doing a lot of important work. There's a lot more to be done, but a lot of important work to unravel a lot of these false teachings that have happened over generations. I feel very confident now that I spend a lot of time actually doing a lot of education, both locally and nationally, and the medical students that I have the privilege of interacting with now are very well versed in cross-cultural education and would not nearly fall for some of the false teachings, just like you saw in the clip. Those nurses knew that those answers were wrong. Our students today are very much equipped and very much aware that a lot of those older teachings are not correct at all.
Well, it's nice to see that progress happening. We have to take a quick break. Coming back, we will talk about the omnibus bill. Welcome back. I want to talk about this omnibus bill that's working to make a change on Black maternal health in North Carolina. It calls for implicit bias training programs for maternal health care providers, a clear outline stating the rights of perinatal care patients, and training for community health workers on postpartum warning signs. Senator Murdoch, let's talk about this implicit bias training. How would that work? Who would get this training?
Yes, as we've talked about, we all bring bias to our jobs. So no matter what it is that you do, you are informed by your lived experiences, how you were raised, what you were or were not exposed to. And since it is a matter of life and death when it comes to Black maternal health and those that work with patients, we believe that we need more implicit bias training to call this out, to actually fund these trainings. So we put $1.5 million in this bill for that training. And when we talk to physicians, they're supportive. They're supportive of knowing that, as was shared in the previous block, there's a lot to unlearn when it comes to how you treat women of color, Black women. So we wanted to put that in the bill to make it clear that we believe it's something that the state government should support as well, and not just leave it up to physicians or private entities.
So would state workers be getting this training? What types of institutions will receive it?
Yes, it also would include employees with the Department of Health and Human Services. So we would be partnering with state agencies. And it also is to signal that we have to address implicit bias in this field. And so we strategically added it to the legislation to call a thing a thing. You can't address what you ignore. So we wanted to specifically call out implicit bias to show that it is a huge factor when it comes to why outcomes for Black women are not as good as these other demographics.
You say call a thing a thing.
Call a thing a thing.
State initiatives promoting this type of equity work are being challenged left and right. We know that DEI programs within college campuses are being repealed. Does this bill have a chance of passing?
Yes, I will admit this section of the bill probably is what makes some folks not pay attention to all of the legislation, but we're going to move forward with it because we know that racism does exist. We know that folks bring it into their workplace. We know that in the instance of Black maternal health, it can cost someone their life if you ignore their symptoms or their signs or walk into these rooms and don't truly hear a patient simply because of their race. It can cost them their life. So for that reason, we're not going to ignore that, and we're going to continue to put it in Momnibus as long as we file it. And also have to highlight, even at the federal level, you also are seeing similar strides. Congresswoman Alma Adams and Congresswoman Lauren Underwood have filed it federally, and they also really implore folks to address the implicit bias that we're seeing each and every day.
Dr. Watkins, you talked about the postpartum situation that you faced. Those warning signs, as we said, can save lives. Can you talk about what you're hoping that physicians will be listening to?
Sure. And I also wanted to say a little bit about what Senator Murdoch said. Implicit bias is not only about race. Black women sit at the intersection of both race and gender. Yes. And so what we're seeing is that there are possibilities for, especially if Momnibus is passed, for all women, all birthing people to experience a better birthing story. And so I just wanted to make sure I point that out, that it's race is a caveat of it, but it's not the only. For me, what I would hope for providers to take that piece of the bill, what I want them to do is apply it, to not just kind of put it in their pocket and say, oh, I'm trained now, I'm good, but more of how do I apply this to my regular practice? How do I make this a part of my standard of care? How can I ensure that even once I step outside of the labor and delivery room, that I'm still applying this even with my coworkers? I'm applying this with staff members at the administrative desk. How can I, apply this even at the grocery store? Because once it starts to become a regular routine, then it's no more like, oh, I have to remember to do this once I go into the delivery room when I deal with this one type of patient. It becomes something that is habitual. It becomes mundane. It becomes a part of who you are. And so that's what I'm hoping for with providers.
What specific signs, and I say this just as you do, this is for all women. What signs should all women be paying attention to postpartum that could be a red flag?
I'm assuming that was for
yes,
me.
Dr.
Yes,
Miller.
yes.
Yeah.
So there are many to consider. Certainly some of the common ones that we talk about are highlighted nicely in the CDC Hear Her campaign. So if you're not familiar with that, there's excellent resources. Headaches are a huge one. Headaches, especially headaches that don't go away with simple remedies, things like drinking some water, taking some Tylenol. Vision changes, especially something that is persistent, flashing lights, things like that. Certainly chest pain, shortness of breath. Dr. Watkins beautifully articulated some of the symptoms that she had, especially that shortness of breath with laying down, sudden changes in weight. Really, and what I would like to impart to folks is that you don't have to try to be your own doctor. If you are worried, it is reasonable enough to call your doctor. And we are happy to take those calls and to talk to folks. We don't expect you to know what is and what is not of concern. Ask the questions if you're not sure.
Absolutely.
And if you're not going to call your doctor, call your doula. I get plenty of phone calls before I say call the doctor because they want to make sure that their call is something that they should call about. And they don't always feel comfortable calling a doctor. So there should be someone that you feel comfortable asking.
Right.
Have a doula, a support person, but don't just hope it gets better.
Ms. Rouse, I want to talk about what you do as a doula. It's an incredible role as an advocate. We're going to do that after the break. Stay with us. Welcome back. We continue to discuss the so-called Momnibus bill and also other efforts to provide solutions to improve Black maternal health outcomes. Ms. Rouse, I want to talk about what a doula is. Some people, maybe they've heard about it, but they don't really have an understanding of the work that you do. So tell me what it is that you do.
So doulas support pregnant people and their families prenatally while they're in labor and in postpartum with physical support, emotional support, and informational support. So we are there through that whole continuum. We're the only people that are there. You go in and out of a doctor's office. You see the nurses that are there on the floor. In the postpartum, you get who was there at the office that day. So we are the people who kind of help people to understand what they need to know. We help them to understand what they can do themselves to prepare for birth and prepare their minds, their bodies for the experience of birth. And we help their support team to know how to support them as well. So when you talk about those warning signs, we make sure that their family also recognizes, because if she doesn't say it, then we need to make sure someone is looking out for it. We make sure that they understand how to support during labor. We make sure that they understand, go to the appointment with her prenatally so that you have someone else in the room that's hearing this information, that remembers the question you asked that you forgot about, right? So we help support them in all aspects of preparing and through the process.
Dr. Wheeler, why do you think that this type of support is needed? Are OBs not able to provide the time to offer that additional support? Why is it that there has to be another person helping pregnant women through that process?
I think what Ms. Rouse just highlighted really speaks volumes. It's that a level of consistency that is challenging in our current setup in medicine to provide. Having that same person who's seen you time and time again. There are often challenges when the first time I'm seeing a patient to know, is this how the patient always feels and how they always look, or is this a dramatic shift? And so we, certainly myself and many of my colleagues, really value the support and the additional expertise that our doula folks are bringing to the table, especially because they're providing that consistency that right now in the medical field is admittedly a challenge oftentimes.
You know, I will say personally, I did stories on some of these horrible outcomes for Black women, and then I became pregnant in 2022, and it became real in a whole new way. And I found myself not wanting to explore some of these statistics because it was bringing me down. It was taking the joy out of my pregnancy. And I know a lot of my friends have felt the same way. Senator Murdoch, how can we bring the joy back in our pregnancies? What are you telling women about the burdens they don't have to carry and the resources that are available?
Yes, as you said, just bringing the joy back. And I think it's unfortunately a little bit of all of it. You've heard Dr. Watkins' story today. I'm sure Dr. Wheeler has a number of stories, and we do have to share them. It really is about awareness. That is a big part of why we will continue to file the Momnibus, or to get those stories out there, but for folks to also share their positive experiences. So in talking about doulas, there actually is a lot of interest. Even with my majority member colleagues around doulas, I do think when we go back to session that there is an interest in providing state dollars to offset the cost of doula care. And if folks didn't share those amazing experiences, one of the representatives that they met with is one of the chairs for healthcare. And to have someone like Ms. Rouse to come and talk about those positive experiences really, really go a long way. And so even though we've had those near misses, getting those positive stories out there, empowering women to share their stories and what they've been going through.
Because there are resources, you all represent that, and I'm so grateful for the work that you're doing to make sure that Black women are having beautiful experiences as well as all women, right? We want good outcomes for all women. Dr. Wheeler, Ms. Rouse, Dr. Watkins, Senator Murdoch, thank you so much for your time. And if you're a family expecting a baby, you want to connect your loved one to resources, Duke Health, Advanced Community Health, Lead Doula, Equity Before Birth, Birth Sisters Doula, they all have resources for you. Thank you so much for joining us. Have a great night.